Now, the WHO, during its weekly update on the novel coronavirus on Thursday, observed that the number of infected persons has taken a multiple pace. The update marked the 6th month since the declaration of the COVID-19 as a public health emergency of international concern. Details of that in this report.
Almost 16 million cases have now been recorded to WHO, with more than 640,000 deaths worldwide. In the past 6 weeks alone, the total number of cases has roughly doubled. Many states have relaxed emergency restrictions intended to cope the further spread of the virus within and across the globe. These, according to the executive director of the WHO's Health Emergencies Program, Michelle Ryan, will require pressure on the virus to suppress its strength.
I think what is clear is that countries that have implemented control measures have suppressed the virus. And when those measures to suppress the virus are lifted, the virus returns. And I think what is clear that pressure on the virus successfully pushes the numbers down, release pressure on the virus, and the numbers can creep back up. So whether we're dealing with second peaks within the first wave or second waves, in some senses is not the right question to ask. The question to ask is, how much pressure do you have on the virus?
For her part, WHO's COVID-19 technical lead, Maria, said the new normal requires how people maneuver with the virus to resume normal activities.
What we're going to have to figure out, and I think what we're all going to have to figure out together, is what our new normal looks like. Our new normal includes physical distancing from others. Our new normal includes wearing masks where appropriate. Our new normal includes us knowing where this virus is each and every day, where we live, where we work, where we want to travel. And that's going to be part of how we move forward with this, finding the balance between keeping the virus transmission low and resuming normal activities.
The lifting of travel measures posed a great threat in mitigating the spread of the virus. These, however, Ryan said, will serve as a challenge to the governing body in the fight against the pandemic.
It is tough on people right now because as countries like everybody else in the world move through this period of continued uncertainty, it is difficult to get those travel measures absolutely right. You can open up and then have to shut down, and then open up and have to shut down. And some people say, well, better to stay shut because that's more consistent, but it's also not making any progress. So how do you make progress with opening up national and international economies? How you do that in a way that's least risky, but how do you do that in a way that you can pull back if you need to, slow down or reverse? And that's the conundrum we're facing, both in terms of national travel and international travel at the moment.
According to the latest WHO COVID-19 situation report, more than 15 million confirmed cases have been reported, resulting in confirmed 6,416 deaths. In Africa, more than 800,000 cases of the virus have been recorded, with a death toll of over 17, according to the Africa Center for Disease Control and Prevention. Although experts are working towards the attainment of a vaccine to the deadly virus, Africa joins the fight in the discovery. Africa CDC on July 22nd, in collaboration with the WHO, launched an advisory committee on traditional medicine for COVID-19 cure. Among the consortium for the COVID-19 vaccines trials, one vaccine has been approved by the China Central Military Commission for clinical trial. For iAfrica TV, Sohna Tunkara.